So as you guys know, I want to be an oral and maxillofacial surgeon. So I'm always searching for ways to find training routes. So far, the only route that I can think of is the training route within the UK. This website is actually entitled the Intercollegiate Surgical Curriculum Program. It highlights what is required during the training pathway for those that want to train in oral and maxillofacial surgery within the UK. The website starts out with an overview, which is really cool. It just highlights what oral and maxillofacial surgeons do, which is treating diseases affecting the mouth, jaws, face, and neck. And then it shows all the kinds of procedures that we carry out, or the kinds of conditions that we deal with the cranial maxillofacial trauma, cancers of the head and neck, diseases of the salivary gland, just to name a few. Temporomandibular joints is another big one, and surgical removal of impacted and buried teeth, that's another big or common procedure. We also do aesthetic facial surgery and deal with facial pain. So this list is pretty exhaustive. This also shows who oral and maxillofacials work with. We work with ENT surgeons, neurosurgeons, orthodontists, restorative dentists, oncologists, plastic surgeons as well too. So that's pretty cool and interesting. It highlights what you're supposed to have completed or be competent in once you've gotten your certificate of completion. So it even says right here, all trainees should have been routinely exposed to them to the key procedures associated with oral and maxillofacial surgery. So prior to the award of the certificate of completion, these are the key topics and associated essential procedures that all trainees in the UK should at least be competent in, which is surgical extraction of unerupted impacted teeth. They have management of patients with dental alveolar pathology, and the list goes on. Management of maxillofacial trauma, management of salivary gland swellings, management of orofacial pain, temporomandibular joint dysfunction, management of patients with benign jaw tumors, potentially malignant and malignant epithelial tumors of the mucosa of the skin, management of patients with developmental or acquired deformities of deformities of facial skeleton, cancer of the head and neck region, reconstructive surgery, patients requiring osteointegrated implants. I mean, the list goes on. So it also assesses your work ethic. So you have to display these basic, which I think every physician and dentist should have, which is good clinical care, communication, teaching and training, or be able to coach those who are young, or tutor those who are younger or are more green than you within the profession, keeping up to date with your information, managing your time or management of patients correctly. I mean, these are basic things that you should have even now before you enter the training program. As you see here, the training goes up from 1 to 7, even though right here you can see that 6 and 7 have been cut off. But the website itself highlights what is required from ST1 to ST7. This that I showed you here was actually required from ST1 to ST7, which is kind of self-explanatory. And then these requirements that I'm about to show you is between ST3 and ST5. ST3 is where the MRCS would come in, because you have to get your MRCS, ARCP credentials, as well as your ATLS, basic life support, and all of those credentials to move from ST2 to ST3. So this is the intermediate stage. So in the intermediate stage, entry into this will usually involve a competitive selection process. The current person specifications for entry into ST3 into oral and maxillofacial surgery are shown on the Modernizing Medical Careers website. I don't have that right now, but the link is actually there on the website. So as I just told you, ARCP is required, WPBA, and the MRCS is required. I think ATLS is also in there as well too. You have to be able to be pretty competent in that. So you actually have a logbook. So this logbook should record development of operative skills and any deficiency in experience or competency during ST3 to ST5 must be corrected during this period. So it's literally, you're on your own under the tutelage of your consultants, but you have to basically to man your own ship when it comes to your training. So you have to keep abreast, read, make sure that you are knowledgeable and well aware of what's going on and what's changing within your profession. On completion of the ST5 of specialist training, the trainee will have acquired increasing competence in the perioperative care of the maxillofacial surgical patient, competence in the diagnosis and clinical management of most oral and maxillofacial conditions, and competence in the operative care of greater range of oral and maxillofacial conditions, i.e. in addition to those listed for ST3 and ST4. So this section gives an example of some other areas of the curriculum that is: the following problems are commonly encountered and should be managed competently by the end of ST4, up to and including operative intervention if appropriate. So here's another list, which I'm not going to go through in detail, but maxillofacial trauma, you have to be able to manage. You have to do open reduction, internal fixation of fractures of the symphysis, body angle of the mandible, zygomal fractures, you have to be able to manage reduction and fixation of Lafort type 1 fracture, salivary gland surgery, as I mentioned before, orthodontic surgery, genioplasty, mandibular ramus osteotomy, Lafort 1 maxillar osteotomy. I mean, the list goes on. The final stage is ST6 and ST7, and training comprises 2 indicative years, which is the purpose of this final stage is to allow training to acquire and develop the specialist skills, knowledge, and attitude that will allow final progress towards achievement of the certificate of completion in the specialty, with the beginning of special interest training as appropriate. So by the end of this training, all trainees, including those who have followed an academic pathway, should have acquired the competencies and specialist surgical skills that will form the basis for safe clinical practice. So these are all of the different specialist area or special interests relevant to oral and maxillofacial surgery. The list is pretty exhaustive. There's ascended maxillofacial surgery, osseointegrated implant techniques, advanced reconstruction of the mouth, face, and jaw, head and neck, oncology, cleft lid and palate. I mean, craniofacial surgery is another one there too. So this website is really interesting, I must admit. There's so many things that oral maxillofacial surgeons do. We manage Lafort fractures, as I mentioned. We do grafts, orthodontic surgery. I mean, when you look at it, it's not just 1 or 2 things we deal with, because most people think it's extraction of teeth and that's it. But no, like, oral maxillofacial surgeons they're sort of ENT surgeons, but we deal more with the mouth and everything in between the mouth. And we do deal with what the ENT surgeons deal with. We even do some ear procedures as well too, even though ENT surgeons will deal like grommets and putting in, and auditory aids. We don't deal with that. But I just thought this website was really interesting, and I thought I would share it with you. So stay tuned, and I'll try to find the curriculum for training pathways in the US, but this is the UK, and this is what I admire, and this is what I know so far. So thanks for tuning in.